Good morning, happy Valentine's. Already you probably celebrated, or this whole month of February is Valentine, and wish you all the best for the coming year. And I hope our last year was so dark with COVID, and today it's continuation of our program on adolescence with Dr. Banik, the Dr. Banik, who is a clinical psychologist, as I have said, and he has, during his practice, seen many of the cases. In addition to that, he is also our community leaders. So continuing on adolescence, so Dr. Banik, tell me what are the positive and negative aspects of adolescence, this period during our growth. All of us have been there. We probably don't remember or don't want to remember. So what do you think are the positive and the negative?
Well, each and every human being has to go through this process of puberty and adolescence. They have to go through the changes that occur because of the endocrinal changes like hypothalamus, adenoid and pituitary glands that bring a lot of changes, both positive and negative. Girls, for the first time, they develop breasts, and that can be both positive and negative. Many can utilize their breast to attract the opposite sex, and some girls might feel very awkward. They might feel very much unhappy. Secondly, they develop facial and pubic hairs. That can also cause problems. At the same time, also, that can give the boys that they are now men.
Is this the time they start shaving and they are
Yes.
conscious about their, beard, and how do they go through this?
Well, because the parents have to prepare themselves that at the age of 13 or 14 they will have some hair, and both the facial hair as well as hairs on the pubic area, and that can cause some problem for many there. Thirdly, in case of girls, the menstruation starts.
Yes.
It can even start early, and that can be extremely frightening experience for girls who have never been told by their mothers, elder sisters, aunts or grandmothers that this is inevitable. Every woman, mostly every woman.
Dr.
has to go
Banik,
through
what
that.
are the cultural differences? Like for me, till in my puberty, I was in India, and my father being in foreign service, we traveled. And so what are the cultural differences? Because in this country, they start sex education as early as 10. So what do you think are the differences in India, say, for example, and those who have grown here during
in
the
Indian
puberty years?
culture, generally mothers and grandmothers and aunts, they are the one they prepare. And I have seen that when my sisters and my nieces were going through the pubertal stages, they were preparing them for a ceremony, because this is a great event. When the girls first start menstruating, they celebrate.
That's what I have heard in Bengali custom. It's a big thing.
Mm-hmm.
So,
and you know why it is done that? Because they tell them they have become now full-fledged women. Mm-hmm. Now you can reproduce of your own. This is the best way to prepare themselves. They feel good about that. The whole society, whole community celebrate.
But I have also heard growing up, I had some very good, good Bengali friends. But when a woman in the house has menstruation, she can't enter the kitchen. Is that true today also?
Yes, well, not now. It used to be. They used to think that because she's dirty, filthy, and all those things there. No? Now things have changed. Even I remember when my elder sister was delivering, they used to keep it separately. Now they go to hospital. Things have changed and are changing for good.
Yes, Dr. Banik, I remember so long ago, I had a friend and she would always say, I can't enter the kitchen. I have my period, so my mother or father, they will do. But what happened one time, both mother and daughter got same time. And then the father, in India, that generation when I was growing, men didn't do any kitchen work, nothing. It was maids or the women. So she says, it's a big calamity in our house. No, we women can't enter the kitchen. We can't even go to temple. So I said, what did you do? I said, my father said, oh my God, please don't do this to me. But in my culture, I'm from Kashmir. It is considered, they get all concerned, all the elderly, that, oh my God, girl is now marriageable age. We have to watch her because she's in the childbearing. In fact, I didn't know. I didn't tell my mother. I'm saying it publicly. I was so scared that they will start talking about my marriage. I was 12 and I didn't want that. And my mother found it accidentally and she said, oh my God, you didn't tell me? So anyway, tell us about more, what are the other aspects of the adolescence, boys, we talked about the physical. Let's talk about the mental state in both boys and girls.
Well, before I go to the mental state, let me also highlight a little aspects of the boys, Boys develop physical strength. They get weight, sometimes.
Oh yeah, they have wet dreams.
Yeah, and so they become very much aware of their sexual urges, and they want to be attractive to the girls, So they play sports and gyms and all the things. And also, one of the most important aspects I forgot to mention is the peer pressures, peer group. They want to belong to the same age group because they hate the authorities. They despise the authority because they do not accept them as adults because they're still marginal. But the peer group, they are the one they support. But let me also highlight, because of the pandemic, nowadays many young boys do not have that support. They do not meet because the physical
They
distance.
meet only virtually. When I ask my nephew and nieces, hey, how is the life? How is the dating? He says, Aunt Lalita, what are you talking? We have no date. Our parents are watching. You can't go anywhere if they are living with parents. So we are having virtual parties, but we are frustrated.
Well, let me also add here, because of that, they remain cooped up in the house and they become lonely, isolated, and that they don't have much to do, and they fight with their parents. And they might use some alcohol, marijuana, other drugs to make themselves feel good. Because of that, many of them get severely depressed.
Yes.
And that depression lead to many times suicidal tendency because they have some
suicide tendency is very high among teens here and in India. Go ahead. What were you talking about? The suicidal thoughts?
Well, many even commit suicide because they cannot face the present situation because of their being completely locked down, isolated, and they have no outlet to channelize their energy, especially the energy that they have developed, sexual energy and physical energy. They have to use self-inflicted.
So, Dr. Banik, till this pandemic is over, now that vaccine is out, it will still take almost 6 months to 1 year. So what do you suggest, what do you recommend parents? These days, young people live by them. So what do you suggest how to deal with this loneliness, confinement for these young adolescent boys and girls? What do you suggest they do?
Well, parents can play a very important role. I know they themselves are going through the same problem of isolation and depressions, etc., but they are more mature. They need to talk to them. They need to guide them. They need to listen to them. Communication is very, very vital at this time. And without that, that can lead to more serious problems.
So, Dr. Banik, as we were talking, how should these young adolescents deal with the mental health problems?
Well, before I go to the mental health problem, let me tell you one thing, that because mood swing is a part of the adolescence problem. Because of the endocrine changes and body changes, physiological changes, social changes, behavioral changes, they go through the mood swings. So parents and support system should be aware of that mood swings. Besides mood swing, they also develop severe anxiety, fear, isolation, loneliness, and abandonment.
How should parents handle it? You know, these days, especially in this society we live, and parents are themselves going problem. How can patients, instead of putting them on the spot, how can they discreetly help them?
Well, most important is communication. When you sit on the dining table or lunch table, talk to them, ask them how they are doing, encourage them to develop new hobbies, new interest, creative energy. They can even do some, now it is winter time, but before that, gardening or new technique of developing their own skills. So there are many, many ways of handling that. Communication is the most vital. You cannot leave this without communicating, even though you know they are wrong. But they are your children, they are your sons and daughters. You have gone through the same problem yourself.
Yes,
so now you have to use your skills.
I remember I didn't have any help. You know, my father was very authoritarian. His word was the last word. But raising my daughter here, it was the opposite. I used to think twice, should I say or I'll get back. So thank you, Dr. Banik. And with this, we conclude today's episode, today's segment, and wishing you again happy February, happy Valentine's.
Happy Valentine's Day.
Bye.